Good afternoon, everyone. Just give it a few more seconds to see who else is attending. I'm probably suggesting wasn't great doing it in half term. I know there's a lot of people on well-deserved annual leave this week, but just give it a few more seconds. Okay, I think I'll make a start, and others may join us. So yeah, good afternoon, everyone, and thanks for joining me on another question time session. So really keen to hear that this be two-way, and I hear from yourselves as well. But just to start, just a few things that I wanted to flag really and communicate with you all this afternoon. So firstly, huge thank you. I say thank you a lot to teams, but continues to be tricky at the moment. Obviously still dealing with COVID and the pandemic that we're currently in, but as well as trying to get our patients treated as quickly and as timely as possible to make some dent into our waiting lists and patients that require our services. So you know, I know people are working incredibly hard, so thank you from myself and all of the senior team. Just to touch on COVID, and I've said previously, it hasn't gone away. It really hasn't gone away. So if I take as an example, Telford currently have the highest community prevalence of COVID across the country at the moment. So certainly Friday, I haven't seen any data as yet from this week, but it reached over 600 per 100,000. So significantly higher than West Midlands and England average. I can't tell you the reason necessarily why Telford. Obviously public health, again looking into that. Something around schools has certainly been raised, but just so that we're all fully sighted, you know, COVID still hasn't gone away. What can we do? And this is sort of conversations I had at system level, certainly on Friday. I think the messages are we can continue to do the good work and good measures that we put in place during some of the heights of the pandemic. You know, such as if we can work from home, continue to do so. Obviously within hospitals and within our hospital, we wear our face masks, keep our distance, wash our hands, etc. So really a plea is that we continue to do that, but also that we consider outside of work as well. I know it's not mandated, but if we can role model good practice. I find it quite shocking. I took a train for the first time last week. Ventured out. That was quite shocking in itself. First time since COVID had hit, but I was so shocked. I boarded a train and you wouldn't have believed COVID was still with us, both from the service, as in no hand gel, no distancing. I think I was one of very few people that wore a mask on that journey, and I couldn't help but calculate on this carriage alone how many people potentially had COVID. So yeah, where we can, you know, for protection of ourselves, you know, each other and our patients. Again, going into shops and supermarkets, I'm sure you're all seeing similar things, that actually the absence of space and face mask wearing is considerable. Tesco's had no hand gel when I went in on Sunday, and nothing to clean your trolleys with. So yeah, although I did raise that with them. But yeah, whatever we can do to role model good practice to try and get the current situation that we're in under control. And of course, the other thing we can do is continue, making sure we get our booster vaccines and continue to do our lateral flow testing. I lateral flowed every day after that train journey for my own peace of mind. So yeah, let's do everything that we can possibly do. Just on sort of COVID IPC, is Sarah with us? I can see Jo shaking her head. No, okay, I can do this. But so notwithstanding what I've just said, there's been, and I think we've touched on this previously, nationally they've released 3 recommendations to enable NHS organisations to help support the backlog and restoration of services. 3 are around social distancing, and that's for inpatient beds, elective inpatient beds, enhanced cleaning and testing regimes. Sarah's led on a piece of work that involved lots of others around whether we adopt them recommendations or reject them in simple terms. From a testing perspective, the recommendation is we continue, we reject that recommendation about stepping down testing and keep what we've been doing in place. Totally supportive of that, because it's a mitigation, I think, for the other recommendations that we've been reviewing. Oh, I see Sarah's name, George. Sorry, I don't know if you've heard what I've said so far, if you want to pick up or you want me to carry on.
Oh, sorry, Stacey, I've just joined. Apologies for being late. My last meeting overran. But were you talking about the IPC recommendations and that we're taking proposals through board on Thursday? And
yeah. So I can finish off. I think the other one was around enhanced cleaning, and again, it's not around not cleaning. It's going back to what we did previously, which is more around the change in the chemicals that we're using as opposed to cleaning. So we will partially adopt some of that recommendation, because the consequence of that is the medical equipment and eroding, that detergents, etc., that we've been using during COVID. From a social distancing with beds, we are, again, it has to go through board, but we're looking at potentially reintroducing some of them beds, but on a demand basis. So as surge beds as opposed to bringing them in as beds that we'd use on a daily basis. So once it's gone through board, certainly as board sign off, we'll communicate out quite clearly what that means, because at the moment it sounds a bit garbled, but we'll make sure it's really clear around what we're looking to change or what we're moving to. Just off the back of that, there is potentially another 4th recommendation, certainly that more for primary care, but does factor in waiting rooms. So we will be reviewing that in line with things like outpatients, therapies, etc., to see if we can do anything now. Again, for assurance purposes, for all them recommendations, we've done quality impact assessments. So looked at where there is risk, how further we can mitigate that. So as I say, that will be going to board this week for sign off. But yeah, sounds garbled, but bear with us. We'll make it as clear as possible. Sarah?
Yeah, thanks. And just to add to that, we've got a small task and finish group that we're kind of working through the logistics of it and kind of the practicality. So again, the outputs from that group will be communicated to everyone as well.
Brilliant. Thanks, Sarah. Good point. And sorry if I keep coughing. It isn't anything suspicious. I've just got this frog that I can't clear from my throat today. I've done a lot of talking, so it's that's why I'm keen for you to start asking questions. There was just a couple of other things I wanted to touch on, non-COVID related, and firstly, a huge congratulations for the results following our national inpatient survey, which people will have seen in comms. We were finally able to share and see where we compared with other trusts across the country. Just to note, the survey was taken in November of last year. So again, from I think really clearly shows that despite the changes and challenges that we faced, you know, it didn't affect or impact on our patients' care and experience during that time. So huge congratulations to everybody. Spent some time last week getting round departments. Again, just you know, if anything can boost morale, I think it's seeing results and what our patients really think of us like that. So just to recap, because I love saying this, so I'm going to do it at every opportunity I possibly can. So rated #1 in the country overall for patient experience, for trust and confidence in both our nurses and doctors, the cleanliness of our wards and departments, food, but I must put in brackets for the 15th time, no pressure, which I did feed back to Phil and Sian. Every time we get these results, I assume their heart stops, and respect and dignity. For all the other questions within the survey, you know, we had some seconds, and for a large proportion of them were in the top 5 trusts in the country. So that's up against other specialist trusts as well as acute DGHs. So phenomenal results. But yeah, something to be extremely proud of. And I think something to not lose sight of, as well as we continue forward. Yeah, you know, we may question how we approach things, but I think we approach things in the right way. If certainly that's what our patients are feeding back to us. And then just on surveys, again, really keen. I keep mentioning this again at any forum that I possibly can, but as people will be aware, our national staff survey is currently out for us to complete. Continue with the hybrid approach to ensure, you know, we can reach as many staff either electronically or paper copies. And again, it's the results that help frame how we're going to move forward as an organisation. And I don't feel I can do that without getting the feedback from the staff that work here. You know, what we do good at and what we need to improve on. So please, if you haven't, and any colleagues that you speak to that aren't on this call, please encourage them to complete, as well as with the patient survey. Phenomenal results, but there's also areas that we can pick up that we know to focus on to make improvements. So so please, yeah, as many staff as you can possibly can reach to get that message across. And then lastly from me, before we go over to questions, just a reminder around, I hope you've all saved the date for the Celebration of Achievement Awards, which is, I'll look to Chloe, November the 11th. She's nodding. I've got that. Thank God I've got that right. So as we've said previously, you know, it's disappointing we can't have that face-to-face party, but I think hearing figures and COVID prevalence as it currently is, I think we made the right call to not have it face-to-face. But this way, by doing it virtually, everybody has the opportunity to take part and watch. And if you feel like getting your glad rags on and a glass of something fizzy, you can all sit and watch and celebrate colleagues. So, you know, not the ideal, but I think best we can do currently in the situation that we're in. So they were the main sort of key updates really that I wanted to get across today. So if we've got questions, people please feel free, raise your hands if you haven't put them in the chat box. And Chloe, I don't know if you can help me with the chat box. I've said before I struggle to multitask.
No, that's fine, don't worry. So we'll start with Philip Hulse. So he's firstly started by saying about his wider family's plans for Christmas Day, 35 people from 9 households. So I don't think he's too impressed with that one. He's also asked about, as well as space in therapies, the issue is mixing amber outpatients with green inpatients. Will there be a change in that, as pre-COVID the therapy space was shared and it can't now be? And I know Sarah has put something in the chat responding to him as well, so I don't know if you want to briefly touch on it.
Sarah?
Yeah, thanks, both. So yeah, the new draft IPC guidance, which we're still waiting to be published, is actually moving away from green, amber and red pathways just to 2, so simplifying it to respiratory and non-respiratory. So it's trying to include other respiratory illnesses we might see over winter, such as flu. So our screening processes will need to change at the front desk, so that's part of the task and finish group that we're working through. But Phil, absolutely happy to chat offline what that would mean in terms of therapies, because I think that there will be opportunity to make using that space more efficient for you moving forwards.
Brill, thanks Sarah.
Thanks both. We've had another question as well from Jack Titley, which Sarah has also commented on in chat box. So his is about the rapid testing machine for patients. So does a negative test from that mean a person is green if a PCR result hasn't come back, or do they still need to wait for a PCR result?
Yeah, so because it's a PCR test, they would be deemed negative. The only ask from the Abbott ID machine is if it has a positive test to go through the normal laboratory process, so it can be recorded in the patient notes on kind of our lab-based systems onto EPR. So yeah, if they have a negative test for the Abbott ID, they're deemed to be COVID negative and can proceed as planned.
So can that be shared? Because I think we had a patient yesterday coming on to Alice ward. They'd isolated, but they didn't do their swab. They got a postal one. They didn't realise they needed to send it back, so they just brought it. They had the test for the rapid one. It came back negative, but they were told that they should still be treated as amber. They still had to wait for a PCR as well. So if that's the case, obviously they could have been green. So I don't know, obviously, if everyone's aware of that, if it needs to be shared.
Yeah, of course. Yeah, we can make sure that that's disseminated. Joe, maybe we do it through the tactical group. We pull together some FAQs on the Abbott ID, perhaps.
That's fine.
Yeah. Brilliant. Thanks, Jack. Really good to raise, because yeah, we wouldn't know that intel. So yeah, we'll make sure we pick that up just so people are really clear around what the Abbott ID. As I see it, it's a PCR test, as Sarah's rightly pointed out. So therefore, they'd be deemed green. So, but we'll get that communication out. Anything else, Chloe, in the chat box currently?
Pat's put her hand up, so I don't know if you want to hand over to Pat.
Real lovely, thanks, Pat.
Hi. When you just said that those PCR results negative, is that result not recorded on their EPR at all?
Pat, it's a printout that gets put in the patient notes, and then it would be scanned into EPR that way.
Okay, thanks.
Thank you. We've got another question from Chloe Upton. So she said, are there any changes planned to seating area in Denbies to increase capacity? There's an increased discount to encourage staff to eat in and spend lunchtimes away from desks and work areas, but at lunchtimes it's difficult to find a table to sit with colleagues. And I think we've got Phil on the call as well, so I don't know if he's probably best to respond to that, putting him on the spot a bit.
I don't, certainly I know, Sarah, we briefly touched on it this morning, so, but also Phil's got, but yeah, Sarah, do you want to go first?
Yeah, I'm gonna be the bearer of bad news here, because we have raised the question with the regional teams, but we've been made quite clear that the recommendations are just for kind of in patient facing areas essentially, so not for staff restrooms or break areas. The rationale behind that is because a lot of the outbreaks are happening through asymptomatic carriage and staff kind of mixing at break time, so they're quite clear that 2 meters distancing is to remain in those areas.
Which I understand their logic and rationale around that. Certainly predominantly most well, not most, but a large proportion of outbreaks that were reported. And if I think about ours as well internally, the outbreaks that we managed at Robert Jones predominantly were staff and potentially with the root cause being staff in staffing areas. So I do understand their logic on that one. Phil?
Yeah, I would also like to remind staff that the boardroom has been set aside as overflow staff rest, so that can be utilised for if Denby's is full.
Yeah, thanks, Phil. I do understand. I hear a lot around it's challenging at times with, especially wards and departments as well that have staff rooms and space, etc. So, but yeah, we just urge everybody just to continue what we've done, and I'd say what we've done successfully, despite challenging, we've managed it well. So we must continue to do that. But the areas really that we're looking at from a national guidance perspective is more around enabling or supporting trusts to be able to treat patients in a more timely manner. But everything else, as we've said, needs to remain the same. Anything else, Chloe?
Nothing else in the chat. I was just wondering if either you, Sarah, or Becky, if she's on the call, if they want to touch on COVID boosters and flu jabs.
Well, is Becky around? Here she is.
Yeah, I'm here. Hi, everybody. So we're doing first, second, third booster and 12 to 15-year-olds now. So some of you might have seen that we're a lot busier than we have been. So it is always best to book an appointment, but we are accepting walk-ins as well. Just have to make sure it's been 6 months since your second dose to enable you to get the booster. And then the 12 to 15-year-olds can be booked in now as well via the national booking system. So that's helping us with planning on the numbers. But, we did 600 yesterday, which is a lot more than we have been doing. Hopefully that answers your question.
That's great, Becky. Just to note on just so that I'm clear, which I think I am, on the 12 to 15s, it has to come through the national booking system, doesn't it? Because of the consent element, I'm presuming.
Yeah, I mean, the consent element is done within the vaccine centre. So, I mean, it's always best to do it through the national booking system, but you can walk in and they are advertising that you can walk in, but obviously it has to be with their parents, with them, their legal guardian.
Yeah, bro, thanks, Becky. And I presume flu will continue in.
Yep. Yeah, we'll still continue to do flu. So I've had a question about the people in theatre, because obviously they don't want to walk outside, which is absolutely fine. We can facilitate that they don't have to walk outside. We don't want that to be a stop factor for them coming down here. So hopefully that message can get back to theatre staff that I'm happy for them not to walk outside.
Well, thanks, Becky. Sarah?
Yeah, just thanks to Becky and her team, and we've also got Lisa Lloyd in post now for staff that might find difficult to leave the clinical areas, because we acknowledge it's not always easy, and particularly with, as you say, Becky, the hub's getting busier now, isn't it? So so it's perhaps a bit more of a logistical problem for people to be released for any length of time. So Lisa is available on the bleep. Chloe, I'm not sure what it is, but we can share that again in comms, can't we?
So just to reiterate, people who want the flu, they won't wait in the queue, they'll go straight in, because we've got a different bay doing that. So I don't want people to think because we're busy we can't do the flu. They'll go straight in and straight out.
Well, fabulous, thank you. And Sarah, not to put you on the spot, you might not have the figures yet, but do we know where we currently are with flu take-up?
I think I saw this morning 41%. So yeah, it's still a bit more work to do. So encourage people to go down and get their flu jab. Like Becky says, it takes seconds, doesn't it, to get done.
Yeah. Well, I suppose on that note, not necessarily flu, but COVID vaccination. I know we would have updated people previously around the consultation around mandating just to say, I presume that's still ongoing, and if we hear anything more, obviously we'll start to update people. But at the moment it's very quiet. But I presume that consultations taking place. I'm hearing the likelihood is it will be mandated, for the fact that they've mandated it in social care. Why wouldn't they mandate it in the NHS? So our figures are good. I think 94% of our staff have had COVID vaccines. So overall, that's, you know, it's a great place to be. But yeah, but as soon as if we hear any more, obviously we'll make sure we cascade that information. Anything else, Chloe, that's popped up?
Not in the chat, no, Stacey. One other thing I did think of about you'd maybe touching on was the buddy scheme, because obviously we've kind of refreshed that recently, so it might be worth covering that one. Yeah, brilliant. Thanks, Chloe. So yeah, we did a bit of a stock take on sort of pre-COVID. Now, some of the feedback from the focus groups, staff survey results previously around visibility and accessibility to senior leaders across the trust. So a few different ways that I've looked at through forums such as this, managers briefing that I do, clinical leads briefing. So there's lots of different opportunities for people to get information and also ask questions direct. But then we were also keen around how we support the wards and departments, and people will be aware of the buddy visits, buddy sort of process that we had previously, that the feedback from wards and departments and the leaders that took part in it was they were really positive. People found them useful, both the receiver and the person doing the buddy visit. So we've done a refresh of that. So I think comms, Chloe, came out yesterday, didn't it, around areas, and if Pat's still on the call, apologies, Pat. I know we didn't pick up your area, which we'll make sure we take that away. So real opportunity, and it's not to spy on you. It's to aid you, it's to help, it's to unblock any issues you've got or concerns in the department, or showcase the really good work as well that's going on. Please don't look at it as an inspection or anything like that. It's a supportive system that we've put in place. The other area we've looked at that certainly Sarah and Ruth and Shelley have done some work around is we did the quality and safety sort of walkabouts, patient safety walkabouts previously with our governors and non-execs. So again, we're just refreshing that approach. So not to just do the same, but where things work and we get good feedback, we want to continue that. So we've just done, again, with Sarah and Ruth's support, just changed some of what we're looking for on the patient safety walkabouts, but really keen that we start to safely introduce more face-to-face in a controlled way to make sure you will get the support and accessibility from us that you need. Thanks, Chloe. Good to call that one out. Thank you. Just to say as well, for those areas who have buddies and new buddies, there will be posters circulated to display in staff areas, so staff are aware of who their buddy is. So we'll get that done in the next few weeks. And I think that's it, Stacey, unless anyone quickly puts their hand up or pops something in the chat.
Okay, I'll pause. No? Okay, thanks all. Thank you for joining today, and again, as I started the conversation, huge thank you to everything you're doing and continue to do. And I was extremely proud of them patient experience results. So it was good. I had actually on Friday, I won't say who, but I told one member of staff who burst into tears. I didn't know where to put myself. It was tears of joy. and not any other reason. So yeah, make sure you cascade that. I think it's great news. Okay, brilliant. Thanks all. Take care.
Bye.